Chapter 8, Alcohol Screencast 2. The first part of this screencast is to focus on overall alcohol consumption. Approximately 70% of North American adults consume alcohol, and most do so in a manner that is not excessive. Men use alcohol at higher rates than women. The largest drinking population is young white college students. 56% of college students report using alcohol. 37% engage in binge drinking. 33% of high school students report drinking at least sometimes and often do so in a binge manner. Table 8.4 talks about the harmful impacts that are associated with drinking, and there are many. Now, keep in mind, most of this is looking at college-age drinking and underage drinking. When it comes to death, about 1,825 college students between the ages of 18 and 24 die each year from alcohol-related unintentional injuries. This includes motor vehicle accidents. Assault, about 696,000 students between the ages of 18 and 24 are assaulted each year by another student who has been drinking. Sexual abuse, about 97,000 students between the ages of 18 and 24 report experiencing alcohol-related sexual assault or date rape each year. Academic problems. About 25% of college students report academic consequences due to their drinking. Higher amounts of drinking lead to more serious academic problems. Alcohol use disorder. 20% of college students meet the criteria for a diagnosis of alcohol abuse and 6% for a diagnosis of alcohol dependence in the past 12 months. Other consequences include attempted suicide, injury, unsafe sex, driving under the influence, vandalism, property damage, and incidents that involve the police. The consequences of excessive and underage drinking affect virtually all college campuses, college communities, and college students, whether they choose to drink or not. Now, there are low to moderate use of alcohol has potential benefits. They can be social and health related, whereas excessive intake of alcohol has serious effects on health and nutritional status. The relationship between the amount of alcohol consumed and health effects is described as a J-shaped curve. So let's take a look at this curve. Here we see the curve, and notice on the x-axis we have number of drinks per day, and on the y-axis is health risk. So notice when we look at 1 drink per day, there is basically absolutely no health risk associated with that. And there's actually a greater risk associated with no consumption of alcohol. But notice the exponential increase in health risk as soon as we start to see consumption go beyond 1 drink per day. Now, when we talk about the guidance for using alcohol safely, the first thing to keep in mind here is not recommended that someone that is a non-drinker start drinking. Moderate alcohol consumption is not discouraged if you drink sensibly and in moderation. You should avoid alcohol, though, if you have problems restricting your intake at moderate levels, are pregnant, as there is no level of safe consumption of alcohol during pregnancy, are younger than the legal drinking age, take medications that potentially interact with alcohol, have a medical condition, or are engaged in activities that require attention, skill, or coordination. Another thing to keep in mind here is the mixing of alcohol and caffeine is not regarded as a safe practice. Now, there are some potential benefits of alcohol, and this, once again, is associated with moderate alcohol intake. It may reduce stress and anxiety. It will stimulate appetite and increase dietary intake in the elderly. It will lower the risk of cardiovascular disease, and this is due to the impact it has on decreasing low-density lipoproteins, an increase in high-density lipoproteins, a decrease in the aggregation of platelets, and these benefits are typically associated with red wine and the phytochemical that is found in red wine called resveratrol.